Yeah, and then I think the second part of it reads, now it turns out that her 2016 breast cancer has come back to her spine, which is now being dealt with.
Yes.
So I have an idea of who this person is, and in fact, we actually saw her in clinic a couple of weeks ago. So I'm really, sorry to, I extend my apologies to this patient, knowing that that this problem may have been missed by the doctors that we've seen in the past. It is a bit of a sad situation, and I hope treatment goes well for this patient. Going back to the question, does anxiety mask underlying medical problems that the GP could miss? And it's a tough question, but the short answer is yes, it can. We in medicine call anxiety a great masquerade, in that it can present in a whole bunch of different ways. You can have a whole lot of different symptoms that can seem like something else. So it can be a very hard one to diagnose, and there are other great masquerades out there like diabetes, anemia, depression. Chronic low back pain can be one, where diagnosis can be very difficult to extract out of the presentation. What I'm trying to say is it's not uncommon for doctors to miss some red flags or certain signs that and attribute those to anxiety, because anxiety can cause so many different symptoms. One thing that as a medical practitioner we should all be aware of is that to try and spot these red flags when they come up. And they can be very subtle at times. Best advice I can give to patients is the biggest clue for patients to know if something is not quite right is whether they have a rapidly changing condition, or it's deteriorating and usual treatments aren't really working very well. So we need to have high clinical suspicion when this is the case. So if you've got a chronic low back pain or something like that, and all of a sudden the magnitude just increases 2 or 3-fold, and there's nothing's really changed in terms of your lifestyle or medications or anything, but the pain just has gotten 50, 60, 80% worse, then I would be talking to your doctor about that in more detail. And the other piece of advice I like to give my patients is, if there's something that doesn't feel quite right, if something feels off, or you don't necessarily think what you're hearing from the doctor is, that you're agreeable with, I think it's best to seek second opinions, third opinions sometimes, just to have that peace of mind. I make mistakes. We all make mistakes from time to time. We're all human, and so it can be very difficult to get the right answer 100% of the time. So yeah, always seek further expert advice if you're unsure about anything.